Well, good morning, everybody. I want to welcome everyone to our virtual policy forum on medical debt relief. I'm really proud to be joined by our partners, which we will hear from in a minute. Proud to be joined by our panelists. We have really an expert group here this morning to chat through the issue of the cost of healthcare, and then also the cost of medical debt, not just the financial cost, but other ways that it impacts individuals' lives. And then to talk about some exciting legislation we have here in Vermont that Senator Ginny Lyons and Representative Alyssa Black have been very helpful in supporting and pushing through the Vermont legislature. I also want to thank specifically Roxanne Vogt from Vermont Businesses for Social Responsibility and Paul Burns from VPIRG for their support of this event and for helping us reach so many critical Vermonters at this moment. Following town meeting day and as we head into the second half of the legislative session here in Vermont. You know, our office here in Vermont, our treasurer's office, we're consistently looking for ways to invest directly into Vermonters to help lower costs, to grow our economy, and to make a more resilient economy where everybody has a fair shot at success. One of the greatest issues facing Vermonters and really the country right now is this high cost of healthcare. Vermont has some of the highest costs of healthcare nationally, while our median incomes are not keeping up with that growing expense. This really leaves us and every Vermonter vulnerable to medical debt. We're one medical event away from having the burden of medical debt through no fault of our own. As people probably are familiar, medical debt is the #1 reason for bankruptcy in the United States. 1 in 10 Vermonters carry some form of medical debt. And unlike other types of consumer debt, with the cost of care, you don't know what the cost is going to be prior to incurring the expense. And you don't have the option to shop around, and you don't have the option to forego the costs. And it's something that can hold people down in terms of their credit score, making it harder to secure a loan, making it harder to get loans on interest rates that are favorable to them, having a challenge to buy a home, start a business, and have otherwise economic upward mobility. People with unpaid medical debt are also more likely to put off care, which means their health outcomes can be worse. And also from a financial perspective, becomes more financially burdensome to treat when they don't get the care that they need when they need it. When someone is sick or injured, their focus should be on recovery and not on their finances. As I mentioned, this year, the legislature and our office have partnered to put forward a proposal that would eliminate up to $100 million of medical debt here in Vermont with a one-time investment of $1 million. This is the kind of program we often talk about in our office when we're trying to seek a program that will have a big impact without a big price tag. And I think medical debt falls right into that category. Again, medical debt doesn't reflect somebody's responsibility. It really reflects the gaps that exist in our healthcare system, and it shouldn't be holding Vermonters back from investing in their future, which is why another important component of the bill, which is the prohibition of reporting medical debt to the credit bureaus, is something that I also want to highlight. We announced this proposal at a press conference back in January, and it has been met with wide support and, most importantly, bipartisan support. I want to thank the House and the Senate, and I want to thank Senator Ginny Lyons, who serves as the chair of the Senate Health and Welfare Committee, who's one of the lead sponsors of this bill on the Senate side, and Representative Alyssa Black, who serves as the chair of the House Healthcare Committee, who is one of the lead sponsors on the House side. We're excited to have them here with us today. And just this Friday, the proposal was approved by Senator Lyons' committee on a unanimous bipartisan basis. Again, I want to recognize Senator Lyons for helping us get one step closer to eliminating medical debt, to prohibiting the reporting of medical debt here in Vermont. And not just her committee that was unanimous, but Senator Lyons has gotten 22 co-sponsors of this bill in the Senate, and 16 Democrats, 6 Republicans. So we're excited about that bipartisan support. I think this is a bipartisan issue, and the House reflects a similar makeup as well. So this is great progress. We're excited about that. But again, as we enter the second stretch of the legislative session, we think it's important to continue working to reach Vermonters, to welcome more people across the state into the conversation, for them to learn about the program, for them to learn about the issue that we're trying to solve, to ask questions, and to make sure their voices are heard. So again, I want to thank everybody for tuning in today to participate in the program. We're excited that we can provide this discussion, and we encourage you to stay on. At the end, there will be opportunity for questions. We'll hear from our panelists first, but there'll be an opportunity to type questions in, and we will be able to field those. And we'll also be posting a recording of this webinar on our YouTube channel, so folks can share it or send it around or watch it later if they would like. So at this time, I'd like to introduce our partners that have helped put this event on. First, I want to recognize Roxanne Vogt. Roxanne leads the team at the Vermont Businesses for Social Responsibility and has years of experience here in Vermont's public and private and nonprofit sectors, including in business development, in education, human resource management, workforce development, nonprofit management, and she previously was the Deputy Director of Advanced Vermont. Roxanne's been a great partner for our office for many years, and even before this role, she and the Vermont Businesses for Social Responsibility have been a great partner with the state of Vermont and in other roles that I've served in the state government. So really excited to have Roxanne here, and I'll turn it over to you.
Super. Well, thank you so much, Treasurer Pieciak. And I want to thank you, Treasurer, for the opportunity to partner with your office and also VPIRG on this topic. And to our panelists for your expertise and your ongoing work. I want to share just a little bit about Vermont Businesses for Social Responsibility and why we're supporting this proposal. So VBSR, as we go by, is a statewide nonprofit, nonpartisan business association. We believe business should be a force for good. So for employees, for communities, our state and our planet, and that this good that these businesses are doing is also good for their business. We have about 600 members spread across the state, very diverse in terms of industry and geography, includes startups and sole proprietors, small businesses, the largest employers in the state, so quite diverse. And we always welcome new members into working with us. And so we are focused on a just, thriving, and transformative economy that works for all people and the planet. So to this point, VBSR has been really proud to support this proposal and the work of the Treasurer's Office on reducing healthcare costs for Vermonters. I have to tell you that for businesses in Vermont and employers generally, healthcare is absolutely one of the top issues, if not for some, the top issue that is affecting business viability and growth. So it's definitely something that our organization is hyper-focused on and committed to change for. And so we're so pleased that Treasurer Pieciak has put forth this proposal, eliminating $100 million in medical debt with just a one-time investment of $1 million. And this is especially timely right now because every fall, as healthcare costs are projected for the future year, there's a lot of anxiety amongst the business community, not only in terms of premiums that they may be paying for their employees, and a lot of VBSR members do contribute significantly, if not covering entirely the cost of that care, but our members also care about their employees and their communities, and they're concerned about Vermonters who are struggling to pay those costs, who are experiencing the impacts to their credit scores and the ability to get loans and financial assistance for other purposes. So we are so proud to support this webinar today. We're so proud to support this proposal. And I hope that this webinar is going to clarify what this option poses for our state and people and equip Vermonters with more information to support not only individuals, but businesses, communities, and our economy. So thank you for this very, very important work.
Well, thank you very much, Roxanne. And again, thank you for your partnership. And I want to introduce now our second partner, Paul Burns. Paul is the Executive Director of the Vermont Public Interest Research Group, VPIRG, Vermont's largest nonprofit consumer and environmental advocacy organization. Under Paul's leadership at VPIRG, he's achieved some pretty significant milestones, including the nation's first fracking ban, new toxic regulations, mandatory GMO labeling laws, and then also passing and making into law the country's first Make Big Oil Pay legislation. Before VPIRG, Paul spent 15 years as an attorney, an advocate, and an organizer at Vermont Public Interest Research Groups in New York and in Massachusetts. Paul?
Well, thank you so much, Treasurer Pieciak, for the introduction and more importantly, for bringing this policy proposal forward today and this year, really, in the legislative process as well. We're really grateful for your leadership on this. As you noted, VPIRG as an organization is one that's been around a long time. We have a 50+ year history now. And since those earliest days, we've been about trying to protect consumers in all sorts of ways. But one of the key things that we've worked on over those many years is trying to ensure that we have policies that will help to make healthcare more accessible and affordable for all Vermonters. And so with that in mind, we're really pleased to be co-hosting and helping to promote this webinar and to be supporting this legislative policy proposal as well. You know, there's a phrase that you'll hear probably a few times today, and that is that it's many Vermonters are just one medical emergency away from crushing debt through no fault of their own. You know, getting sick is often part of life, but losing all that you've worked for because of it should not be part of life. And this is an opportunity to relieve that burden for many, many Vermonters. So again, I just want to thank Treasurer Pieciak, thank the panelists who are here today for your leadership on this issue. We're also grateful for Senator Lyons, Representative Black, and other legislators who've taken this issue up in the State House. And just a personal note, I guess I should say I'm grateful to VBSR as well. VPIRG is a member of VBSR. And what you say about businesses being concerned about this, particularly businesses like ours that try to help pay for all of those healthcare expenses of our staff. I mean, it's true that there are many businesses in that boat, and we all feel the challenges that are associated with that, and the challenges of our staff and their families who are grappling with, you know, these really very, very serious problems. So this problem is one that affects many thousands of Vermonters. The good news is there really is something that we can do about it. And so for all of you watching today, I hope you'll learn more about this policy and how it's already beginning to work in other places. And I also hope that you'll consider getting involved so that we can together make sure that Vermont provides this needed relief as soon as possible. Thanks very much.
Hey, thank you very much, Paul. And again, thank you both to Roxanne and Paul and to VBSR and VPIRG for your partnership on today's webinar and on this important legislation. So now I'd like to get to introducing our panelists for today. Again, want to welcome them and thank them for being here. I'll call your name, and when I do, please introduce yourself. And we'll start with my friend, Rhode Island Treasurer James Diossa. Thank you for being with us, Treasurer Diossa.
Good morning. Good morning. It's good to be here and joining my good friend, the Treasurer Mike Pieciak. I had the pleasure to go up to Vermont to his announcement of this incredible, thoughtful legislation of medical debt relief. And I'm happy to be on this panel to share the progress that Rhode Island has made on this front. Thank you.
Thank you, James. Next up is Senator Ginny Lyons, the chair of the Senate Health and Welfare Committee and one of the co-lead sponsors of the legislation. Senator Lyons.
Thank you, Treasurer Pieciak. It's a real honor to be here. I do chair the Senate Health and Welfare Committee. We're working on this bill. We've passed it out, as the Treasurer has indicated. I also serve on Appropriations, which is a great link for funding for this bill. And I also serve on what's known as the Committee on Committees, where we make decisions about who will serve on committees in the Senate. I will stop there, but I did want to say thank you both to VPIRG and VBSR for giving such support to this bill. It is critically important, and just a real thank you for your support.
Absolutely. Thank you, Senator. And I want to introduce Samantha Bunk, who is a health policy analyst at the Missouri Foundation for Health.
Good morning, everyone. Thank you so much for having me. I am honored to be a part of this conversation. So, as you just said, my name is Samantha Shragi-Bunk. I am a health policy strategist at Missouri Foundation for Health. I'm also an attorney by trade. So this is an issue that we've been looking at pretty closely. It's something that's affected me personally, which is part of why I do the career that I do. And I feel very blessed to be able to do that. And I'm honored to be here with you all today.
Thank you very much, Samantha. And last but not least, Eva Stahl, Vice President of Policy and Program Management at Undue Medical Debt. Eva, thank you for being with us.
Thanks so much for having me. I'm excited to be here and in such good company. As you said, I lead the policy work at Undue Medical Debt. At Undue Medical Debt, we are a national nonprofit charitable organization that buys medical debt in bundles. We're able to do this for pennies on the dollar. We can talk more about that later. Then we're able to relieve debt for thousands of people. And to date, we've abolished about $15 billion worth of debt nationwide. So I'm pleased to be able to talk about that work today.
Well, again, thank you very much, Eva. Thank you to all of our panelists for being here this morning. I want to jump right into it. I think in our discussion, we're planning to sort of provide a little bit of background on this issue of medical debt, sort of how it presents itself, how it impacts individuals' lives. And then we want to sort of move over to some of the solutions that have been developed, in particular by Undue Medical Debt and some of their partnerships that they have entered into, including with the state of Rhode Island. And then we want to also have a discussion a little bit later about some of the other steps that need to be taken to bring down the cost of healthcare. We said at our presentation back in January that this proposal was not a silver bullet in terms of helping with the issue of medical debt, nor was it a silver bullet in terms of the issue of high costs of healthcare as well. And we'll have a discussion about what more needs to be done to bring down those costs here in Vermont. But I do want to start first with Samantha and talk about this impact of medical debt. If you're willing to talk a little bit about your own story, I think that is very helpful for folks to hear about. It's very impactful, I think, when we hear from individuals about how this issue has impacted them. But specifically, I do want to ask you, about a study that you recently conducted in Missouri about the impact of medical debt in your state. And, one of the interesting and alarming conclusions was that a wide majority of people with medical debt in your state actually had health insurance at the time that they received medical care. This concept of, and we have a high insurance rate here in Vermont, but this concept that you might be insured, but you're actually underinsured. You have insurance, but there are big gaps in your insurance. Can you speak a little bit to your report's findings and how they illustrate why this medical debt issue is so pervasive in a state like Missouri and certainly in Vermont and nationwide, and even for those that have medical coverage?
Yeah, absolutely. I think that's a good question. So as for my personal story, I'll keep it short and brief. So I want to focus on what's affecting people now. But the short version is that I was born with a medical condition. I was born uninsured. My parents are working class, so I'm actually a first-gen college and law school graduate. And my journey is kind of why I wanted to do the work that I do. I worked for legal services for a long time before transitioning to policy work, but medical debt, for all those reasons, has been a passion of mine because it personally bankrupted my family. So I definitely understand how this affects people and the burden it puts on folks that can be very difficult. As far as our research goes, we've done a couple different things in Missouri. I think, as you said, this is definitely a bipartisan issue. This is something that, your friends, your neighbors, lots of people can either say, oh, this impacted me or this impacted somebody I know, but it can be something that's also hard to talk about. So what we found in our survey was that over half of Missourians, in the statewide survey that we conducted, over half of Missourians have either had medical debt recently or within the last 5 years. This really tracks with the national statistics on medical debt. Kaiser Family Foundation did a study a couple of years ago with very similar numbers. And there are a couple of groups, unfortunately, that are more impacted than others in Missouri. So rural adults, Hispanic adults, those with disabilities, and those without a college degree are more likely to have medical debt. So some of those highest need groups are unfortunately some of those most impacted. As far as what the cause of the underinsured issue, I think it's really difficult because, as you said, so many folks with insurance, 78%, according to our survey, actually, who had medical debt had insurance at the time that they incurred these medical bills. So we also found that quite a few adults in our survey said that if they had an unexpected medical expense of $500 or more, as you said, similar to Vermont, they would not be able to afford it. So even when you have insurance, unfortunately, unlike in my case, many, many years ago, it's still an issue, even if you have insurance. And I think that speaks to really some of the high out-of-pocket costs that people are facing today. As you mentioned, healthcare costs are rising every single year, and there's a lot of things that go into why that is. But I think a lot of people have high deductibles. I think a lot of people have really high copays. So even though many employers, thankfully, do help with premium costs, we see that a lot of the times people are having trouble really affording those out-of-pocket costs, especially their deductible. So when we talk about access to care, yes, it's one thing to be insured. That's great. That's something that we focused on at Missouri Foundation for Health. We have a Cover Missouri coalition that part of that goal with our advocacy work was to lower the uninsured rate to under 5%. We started that over 10 years ago now. Our uninsured rate has come down quite a bit. We've expanded Medicaid in the state of Missouri, which is all great. But if people can't truly access it because they cannot afford the cost, then it's not really true access, right? It's great to have insurance, but if you have an unexpected high medical bill and an emergency cost that you can't afford, then affordability really is at the root of this issue.
Yeah, and I think that's very well put. And I just follow up, Samantha, just for you, you talked well about the financial impact of medical debt that it can have on individuals and on families. And that's one of the reasons that we proposed the legislation here in Vermont. We also talk about how it impacts people's behavior, like their willingness to seek medical care or not. And then there's sort of a third reason, which your research touched on as well, about just sort of the anxiety, the emotional toll that it can take on an individual and on a family, which are harder to quantify from a dollar and cent standpoint, but I think critically important in terms of the legislation we're talking about here in Vermont. So I wonder if you can just expand a little bit on those points.
Yeah, so I think that definitely it impacts people emotionally as well. I think that there's a few things we found specifically when we conducted some focus groups as well. So we did the statewide survey after we first did some individual focus groups for some of those that are often, I don't want to say overlooked, but maybe not as highly represented in some of those big picture surveys that paint a good picture, but we really wanted to highlight the voices of those who are most impacted, who often maybe don't have the loudest voice in those big numbers. So when we looked at those groups, including but not limited to low-income folks, those with disabilities, Spanish speakers, rural folks, one thing that we found that they talked about as far as the emotional toll is that there's a lot of shame associated with medical debt. It can be really hard for folks to talk about. I've told my story several times now, but honestly, until the last few years, it was something I had a hard time grappling with. Not because there should be any shame associated with it. There's so many of us that deal with this, but it's just something that can be hard to talk about. It feels like a shameful thing when it affects so many people, and it shouldn't be. It's just unfortunately an impact of our system that we have currently. But we found that people especially were having a hard time, if they had to borrow money from family or friends, if they had to move suddenly because they could no longer afford their housing as a result of trying to pay their medical debts and keep all their other bills afloat. If they have had their credit scores impacted, they feel like it's a burden that they took on, even though, as you said, it's absolutely no fault of their own if they have medical debt. So it really does take a mental toll on folks as well.
Yeah, no, I thought that part of your research was very illuminating. And, in so many areas of finance, shame plays a strong role, unfortunately, in everything from getting help on medical debt or, not even wanting to talk to a patient assistance program that may be available at a hospital or other, solutions that might be available. We see it in frauds and scams that people become ashamed and don't speak up, and then the frauds and the shame and the frauds and whatnot can perpetrate. So important to share your story, I think, and important to break down those elements of shame. So appreciate you both for your own story and also for your research. And wanted to broaden the conversation out a bit now to talk again about one of the solutions to this issue of medical debt, which has been the work of undue medical debt. And Eva, the question for you, we talked about this program in Vermont bringing forward a program to eliminate up to $100 million of medical debt using the one-time investment of $1 million, and also work to protect an individual's credit score. You know, I think one of the questions I get when I talk about this is, can you walk us through, Mike, the $100 million and the one-time investment of $1 million? And I wonder if Eva, you can walk us through that. And also maybe just at the beginning, you know, I think I first heard of undue medical debt on the John Oliver show a number of years ago. And you have quite an, you know, undue medical debt is quite a storied history in the last decade. And, you know, one of the reasons I feel so confident about us proposing this legislation in Vermont is knowing that an organization like yourself is on the other side when we're talking about implementation, because that's so key and critical. And I think it would just be helpful for Vermont to understand a little bit about undue medical debt and your expertise in this area as well.
Sure, I'm happy to do that. It's great to be here. And I just want to sort of, you know, over the line, give a fist bump to Sammy, who really raised some really great issues, but also just concur. So part of our work, and I'll walk you through the model and how it actually works, but at the sort of at the end of the model is, and the workflow is actually communicating and hearing the stories of our constituents, right? So when people get their letters, they have an opportunity to engage with us. So we do quite a bit of qualitative data collection and understanding the stories and experiences of people with medical debt. And I would just say that, you know, Sammy's 100% on the mark here. Like, so many of people that we talk to are insured, right? So underinsurance is definitely a theme and an issue for folks, as well as stigma and shame and mental health issues around anxiety and stress. Nobody wants to open those bills. Avoidance is a really big strategy for people as they shove bills in drawers, but those debts don't go away. And so that's actually the work that we do. So backing up to a little bit about undue medical debt, we are a young organization, about 10 years old. We were started actually by two debt collectors who decided on a whim, wouldn't it be fun and interesting to not just collect on debt, but actually just abolish it with donations. And so they really flipped the script on debt collection and started our story. And since then, we've really grown. Our leadership has shifted. Our current CEO comes from a background in social services and became very interested in not just the transaction of medical debt abolishment, but thinking about how as an organization we can really amplify the voices of people with medical debt to create an environment where we all want to come together and end it, right? And that speaks to our work in policy and wanting to think forward about how upstream we can mitigate the harm of medical debt, but really prevent it in the first place. So the question is always asked, the first question of us is, how do you do this? Like, this doesn't make any sense. So I think it's important for people to understand that debt is a market, right? And on that market, it's bought and sold. And so because medical debt has gone through the billing cycle, and when it feels like I'm not having a lot of luck collecting on this debt, that it is a moment in time when a healthcare system or a provider could decide to just sort of put that debt aside, even though it still exists, right? Or they could sell that debt. So often when debt is sold, then it's also sold for pennies on the dollar, which might seem crazy to people, but that's actually what the market price is, because while it might not feel worth a lot to the health system or the medical provider that's holding that debt, it actually is quite meaningful for the patient. So when it's sold on that market, it's sold at a very low price, which allows us to really have that great return on investment, which means that for every dollar invested on average, you can abolish and relieve about $100 of medical debt. So because of that sort of consolidated market and the way that it works, it really creates this opportunity for us, not as a debt collector or a debt buyer, but to use those same tools to purchase debt in bulk in portfolios, right? And relieve and medical debt for people that are earning below, we have two criteria, people that are earning below 400% of the federal poverty level, or if those debts are more than 5% of their income. And that those thresholds are really pinned to what the data tells us, which is that, for those families, particularly, you would think, oh, 400% of federal poverty level might be high. It's actually the data point where you start to see medical debt drop. And it really speaks to how medical debt is not, it is a low income issue. It is a middle class income issue, right? It's an everyone issue. And while Sammy did point out that there are some people that are some communities that are disproportionately affected by medical debt, this is true and something that's really important. It's also important to realize that this is something that happens to your friends, to your neighbors, to your family. And it's something that just weighs on people. So this really gives us the opportunity to provide some relief.
Yeah, that's great, Eva. I had to pull up the testimonials that Undo provided from Vermonters, because your work was, prior to partnering with states, you're doing this work philanthropically, and there were some Vermonters that benefited from Undo Medical Debt's work. And I feel like their testimonials, it's very similar to Sammy, but to hear from a Vermonter, this person is Bobby in Richford, Vermont, who says that they received a letter in the mail from Undo Medical Debt, that it was generously provided by a foundation and coordinated with Undo, and that they were so shocked and it touched their heart that they feel like they have been blessed from an angel. They were just trying to figure out how they were going to pay their outstanding medical bills. And again, they say everyone that donates and helps Undo Medical Debt is an angel in disguise. And another person from Vermont, Emily from Burlington, talked about how she had racked up the debt when they had a mental health crisis, and they were put into an ambulance. They weren't properly charged for their insurance, and they racked up a $9,000 bill, and that they were too sick to deal with the financial consequences, that they ended up refusing to pay it because they felt like it was their mistake. They described that they almost couldn't buy a house because of collections, and then they received the debt abolishment letter only a few weeks before giving birth to their first baby, Stella, and that it was, amazing. Can't thank Undo Medical Debt enough. So I'm sure these are stories very similar to what you've been hearing from across the country, but just wanted folks to know that Undo Medical Debt's work, sort of on its philanthropic side, has already touched Vermonters, and the feedback has been really powerful.
Yeah, those are a lot of the same stories that we hear from across the country. There are a lot of negative effects and impacts on people when they have medical debt. As you pointed out, they might not go back to get the care that they need. Depending on the state and the circumstance and the provider, they might have a mark on their credit report, right? Which is why this legislation is so important, to make sure that people's credit histories are protected, because medical debt's not a choice. Right. I think that's really important in how we differentiate it. Medical debt is not a choice, right? It's a debt of necessity is how we talk about it. So I think it really makes it different for people to have a reset.
Yeah, no doubt. Well, we will touch on that issue of how it impacts an individual's health outcome in a minute, but I would like to bring in again my friend Treasurer James Diossa, and want to ask you, James, about the role of state treasurer as financial stewards of our state, and why you saw sort of medical debt as an important issue for you as a treasurer to address in Rhode Island, and how do you see this proposal as aligning with your broader responsibilities?
Yes, thank you. And it's good to see our partners on this panel, Eva, who's been doing an incredible job here in Rhode Island. I think, Mike, as you know, we are always looking for the financial well-being of the members of our state, the people of our state, and also with that, we're always looking for consumer protection that we can try to avoid for or help our residents here in Rhode Island. So when this was brought up by our legislature here in Rhode Island, and they identified that it would be best fit to be in our office here in Treasury, I immediately stepped up, because we're not only just focused on retirement and some of the programs here, we are out there every single day talking about financial literacy at a younger age. We're talking about retirement for those who are about to retire. And this is a good opportunity for us to engage on such an important issue. As mentioned by many of the panelists here, medical debt continues to surge. We want people to get preventative care, makes the healthcare system a little more cost efficient. But it's been noted, this is a huge concern, and we're lucky here around that we were allocated $1 million. We found an amazing partner in Undo, and just in short matter of months, we've been able to wipe off $7 million of medical debt, impacting 3,000 residents of Rhode Island. And I think that's a huge step and a testament that this program works, because I know there's still a lot of people out there who don't believe that government can work for its people. And this is an important step forward for us to show not only the people of Rhode Island, but also Vermont, who are exploring this great opportunity to read that. The other piece to this too is that 2024 is a big year for medical debt. Not only did we get the allocation to waive it, but also the legislature made it a priority to remove it from credit reporting. So this is going to have an even more of an impact as we continue rolling out this program. We know that the success of this program is going to be so big that we've now gone to the General Assembly this year asking for another $1 million allocation to continue working with undue medical debt.
Yeah, that's wonderful. That's wonderful, James. I wonder, James, just in terms of as we think about Vermont as having some of the highest costs of healthcare in the country, and gaps in our healthcare system, I wonder if you just maybe could help us understand sort of what the landscape looks like in Rhode Island in the area of healthcare and costs generally, and then also, how did the program, from your standpoint, from an administrative standpoint, can you speak through a little bit about that? Like, how quickly were you able to get the debt eliminated? Did you require additional staff? What sort of has been the administrative piece from your end?
Yeah, so here in Rhode Island, an estimated about 5.2% of Rhode Islanders have medical debt of an estimated amount of over $1,200. And so we know that that's just the average. There's more out there. When this proposal came to Treasury, we were informed that what would be the best way to oversee the program, manage it, and do we have the capacity in Treasury? And we immediately sought out undue medical debt, and they put us at ease. Rhode Island did not need to invest in personnel. All we had to do is create a process to engage undue medical debt, and I think that made it very efficient, very clean, clear. Also, we all know that the government is sometimes a little outdated, and we want the houser of this information to have the best ability to manage this information, sensitive information like medical records, the information, date of birth, social security number. So, we felt very comfortable and strongly that undue medical debt afforded those protections, and we moved very quickly. Again, engaged in October, we announced it publicly. We're in March now, and I don't think we see government move as fast as that. So there's a lot of positive, and I feel that Vermont and Rhode Island are very familiar as far as what we manage, what we see. I think that I think you can handle this internally with the support of undue medical debt, and won't have any added cost to the taxpayer in your state.
Yeah, no, that's great to hear, Treasurer. I mean, it's one of the things that intrigued me about the program was sort of this partnership you call a public-private partnership, or it's Undo as a nonprofit, but nonetheless, sort of this opportunity to sort of leverage the skill and resources of somebody that has been doing this for such a long time and doing it so well was an intriguing part for us. Well, I want to ask Senator Lyons, and bring her into the conversation and ask her as, as the chair of one of Vermont's healthcare committees, what motivated you to be the lead sponsor on the medical debt relief proposal? And what has the response been so far from your perspective in the legislature?
Well, thank you for that question. It's an easy one to answer, actually. And Treasurer Pieciak, much of my interest in sponsoring the bill initially was because you asked and demonstrated to me that there could be results for Vermonters. My first question, I think, was, how will this help Vermonters? And are there folks in the state who have already benefited from a reduction of their medical debt? And you've read the two testimonials, I think, that are pretty significant, both from Richford, Vermont and Burlington, Vermont. So that was a big determining factor. The other one is, of course, that we have worked on medical debt in the past. We've worked on opening up more transparent billing by hospitals, because some folks are very concerned that they don't know what the bill will be after they've had a procedure. And then we've also worked on a bill that asked hospitals to develop communication on financial planning. But beyond that, everything that we've heard from Sammy and Eva and Treasurer Diossa about the social determinants for people, the lack of resources when medical debt hits them, and the initial illness or surgery or accident, whatever it is that contributes to outstanding medical debt, it's confounding. People don't think about the dollars when they're going into the ED or for emergency surgery. So all of those things together, reducing the shame, taking the burden off of people's shoulders, eliminating the stress that happens when medical debt is compounded. All of those things led me to really supporting this bill very, very strongly. And then it also enabled me, understanding these things with your help before the bill was introduced, to get signatures, not just from Democrats and Republicans, but from the one progressive in our Senate. So it is a tripartisan bill, and I'll share a quick story. I put the bill back in, and then I heard from a couple of Republicans that they wanted to sign on, and I apologized. And then a couple of Democrats came up to me and said they wanted to sign on. So the support is probably broader than the 22 signatures that you see, which is a great thing. This is one of those bills, I think, that will, I think, move forward fairly quickly. And that's just my initial thoughts and motivation. There's so much more embedded in the bill that it's so important for Vermonters to reduce the burden of debt, to take it off of the credit rating so that they don't carry the shame around with them. So those are just a couple of thoughts on why I introduced the bill. And I just say thank you again for the work you've done on this.
Yeah, well, thank you, Senator. I mean, I think you spoke a little bit to the committee's long history on this issue and expanding financial assistance and protecting Vermonters from going into medical debt in the first place. That's a big step. And sort of we view this as an opportunity to look retrospectively and eliminate medical debt for folks that didn't have the benefit of some of the recent changes that your committee made. And then also that prospective piece, as you point out, about eliminating medical debt on the medical reports and how that will be an important item as well. And for those that aren't familiar with the Vermont Senate, Senator Lyons, she mentioned she has 22 sponsors. There are only 30 members of the Vermont Senate. So one of the members of the Senate doesn't sponsor bills because he's the appropriations chair. So that leaves you only about 6 senators that could have possibly signed on. So it sounds like you were working toward a pretty unanimous.
It was very
total.
close to unanimity. Thank you for that. And yes, and I think the further along we go, I think the more people understand how critically important this is, particularly given the environment we're in today.
Yeah, well, thank you, Senator. I wonder, because you touched on your work in terms of transparency in healthcare and focusing on clear pricing, and Sammy's work has also focused on those items and also on standardizing financial assistance across providers. I wonder if Sammy can just touch on her work and how she thinks states, particularly rural states like Vermont or rural areas of the country, can make real progress toward building a healthcare system that does work for everyone, particularly on these issues of transparency, price clarity, and patient assistance. So, Sammy, you're muted.
Can you hear me now? Okay. Sorry, I'm having some audio issues, so hopefully everybody can hear me and there's no lag. I'm having some internet issues, but in any case, there's a whole lot of things that can be done. I'm going to touch on about 4 for the sake of time. So one thing that I think I just want to really make note of that has been highlighted here by everyone is that healthcare affordability is really the main root cause of medical debt. It's the fact that so many people have trouble affording it across the spectrum of, race, class, economic status, et cetera. So when everyone has coverage and when everyone has true access to coverage, this is really what improves healthcare quality for everybody. So I just wanted to make note of that, as that really seems to be a theme here. I do want to mention a few other things that other states have done that have been helpful. So specifically, especially in rural areas, about 1/3 of states have price transparency laws, which is helpful. But I think that the prohibition of debt collection is one mechanism that some states have passed. I know Colorado passed this, but a key mechanism with making that work is enforcement. I was recently talking to an advocate from the state of Colorado who said, we get highlighted a lot as this is this great movement, and that is great, but without a really good enforcement piece, it can be hard to make a difference with that. So that's a good step, but making sure that it really has some teeth to actually do enforcement when we talk about not collecting medical debt for folks. I think that also some states have passed consumer protections that are really helpful for surprise medical billing and some things that were missed with the No Surprises Act in particular. So everybody on this call is probably aware the No Surprises Act was a really great step. But one thing that was specifically left out was ground ambulances. There are a couple of reasons for that I won't go into, but because it was left out, if you get a surprise medical bill, a lot of people who get transported for medical services, unless they're airlifted and they have an emergency, they're going to be transported by ground ambulance, right? If 911 is called. So in that case, really making sure that that is kind of protected against medical debt for surprise billing. So Indiana, Mississippi, Oklahoma, and Washington all in 2024 passed some legislation regarding surprise medical billing and protecting folks when they're hit with a surprise medical bill for ground ambulance services. So I think that can be helpful as well. And then the last piece that I want to touch on is network adequacy, especially in rural areas. This is important. So there are some federal network adequacy laws for the ACA, right? But I think that making sure that folks know where they can go, not just from, they have those giant lists when you have insurance. As we talked about, so many folks are covered when they get hit with medical debt. But if you think someone's in network and then it turns out they're not, surprise medical billing sometimes, can come into play there. But really making sure in the first place, networks are adequate. People have places that they can go, especially in rural places, in rural areas like Vermont, like some parts of Missouri, where there might only be a few providers, making sure that the networks are adequate. So when people go, they're not going to be hit with a surprise medical bill. Hopefully, we can really address the root cause of the problem. And then one last thing that we've all also talked about is making sure that people have true access to care when it comes to who is available. So not just network adequacy, but making sure that we're really addressing price transparency. So every hospital is supposed to have a charge master. When it comes to price shopping, it can be really, really difficult for folks, for the average person, especially who may not know where to go. A lot of our research has shown that people don't know where to go when they are hit with a surprise medical bill. or a large medical bill that even if, they know it's probably coming, they had to go to the emergency room. Like you said, it's never an option. It is a necessity when you have a medical emergency, but knowing where to go for help. So there are different resources available, but in our research, most people didn't really have one trusted source where they felt they could go when they were hit with that medical bill and know what to do about it, know what their rights were. So only about 16% of Missourians said they had a good idea in our research of where to go when that happened to them. So also really making sure people know about when this does happen, after we've done everything we can to address preventing medical debt, when it does happen, where do I go? What do I do? What are my rights so I can advocate for myself is also really helpful.
Yeah, no, thank you, Samantha. I think, a number of those topics have been issues in Vermont over the last few years, and our Senator Lyons, I mentioned, has been working on a number of those, and good to hear about your report and the impact that some of those price transparency and consistency and that network adequacy in particular can have, which I think Vermont's made a lot of great progress on. I wonder that anything you want to mention on that, Senator Lyons?
Yes, absolutely. So beyond price transparency, obviously, it's the crisis that we face in healthcare today. And people are making choices between food and prescription drugs all the time. Our demographic is changing, and that's putting pressure on our long-term care. We also know that the older population has a tendency for greater debt. We also know that medical debt is just not a choice that people make. It's made under the duress of life or death. So all of those things direct us toward this bill. And so in terms of transparency, I think there's one word I think we need to keep in the conversation as we look at how undue medical debt and our hospitals will be working together under your umbrella, Treasurer Pieciak. I think the word trust is critically important, that there are requirements in the negotiations and the work that goes on between your office, the hospital, and the undue medical debt that protect patient data through, obviously HIPAA is a critically important role to play, and it won't be lost in this process. That is very reassuring. It doesn't offer transparency of patient records, but it does protect patient records and offers transparency to the ethical guidelines and medical guidelines that we currently have in place. So and thank you for Sammy for the research that you've done. It's just amazing.
No doubt. I want to take on that point on trust, Senator Lyons, and ask Eva a question. I think maybe it's just helpful to hear about undue process for keeping information, confidential, which would be very, very useful, I think, for folks to hear about. But also, just what kind of trust in the healthcare system and in providers does a program like this instill in people when their medical debt has been eliminated? As we talked about, people forego care. They may feel shame. They may feel their providers wouldn't see them. They may be worried about accumulating other medical debt. But I'm sure there is increased trust in the system and in government and in their provider from a program like this that has been implemented in other states. And so I wonder if you can just talk to that, both of those issues.
Yeah, so let's start with the first one. The first one around just sort of maintaining patient privacy. So we have worked really hard, particularly over the past 5 years, thanks to the generosity of Mackenzie Scott funds, to really build a very robust, what we call debt engine that meets SOC 2 compliance for cybersecurity and safety. And so part of our process is when we build our legal agreements agreements with hospitals, health systems, and providers that were very clear about the safety of patient data, its transfer, just to sort of name that up front. So it's something we take very seriously in all of our work. The patient is at the center of this. So part of that means that keeping patients' information private and making sure whatever data transfer happens meets all of those requirements, and that we have the strongest security requirements around that workflow. So I would just sort of name that up front. And I think one important thing to understand is in our work with hospitals, they are our partners in particular. And so, you know, part of that is maintaining the safety of those files, but also maintaining the privacy of that hospital or health partner. And so it's really then the decision for them to be public about their participation in the program is really up to them, whether or not they make that decision. But privacy is sort of front and center in all of those different exchanges. So I think that's important for people to know. In terms of how this abolishment workflow and effort can really support support patient trust in the system, I think that what we hear from patients is that when they're able to have their debt abolished, it does invite them back into the system and reinvigorate trust in the hospital and healthcare system. Over the past year, we actually have done focus groups and research on actually physician-patient trust around the issue of medical debt with support from the Robert Wood Johnson Foundation, and really found that patients really turn to physicians, frontline healthcare workers, and trust them to have these conversations about affordability. What's, I think, challenging for all of us is that there aren't always good answers. Right. And so I think that, but it's really paramount that both health systems and their frontline healthcare providers and clinicians understand the role they play, and that they're trying to problem solve and show up with empathy for their patients and trying to solve those problems, and that we're all listening so that we're working upstream to mitigate those harms and to help people as best we can in those moments navigate what is an overly complex healthcare system and insurance system that creates a lot of frustration for patients because they just don't understand their plans. They don't understand medical billing, and they don't understand their options, as Sammy said. So I think there's a lot of opportunity to think about how we are creating simpler pathways, simpler ways to understand how these things work, so patients can better protect themselves, but that we're also mindful that people need help. And so we're also supporting all kinds of consumer assistance pathways and different ways to provide patients the help that they need when they're navigating really complex medical bills. But certainly trust is an important part of this whole process. It's part of why our hospital partners choose to participate and be a part of it, because it rebuilds trust with their community, all of which is really important to advancing the health of that community.
That's great, Eva. I want to remind folks that if you have questions, please feel free to type them into the chat and we'll get them to me. But I wanted to touch on something Eva said, and it's a question for her and for James. You know, one of the things that I think is great about this program is sort of the automatic nature of it. People often will ask me, and as I'm explaining this to them, so what do people have to do to apply? You know, what are the steps, or and I think it's a great question because, you know, it's an obvious one, but when you think about programs that the state operates, and when I've been in charge of operating programs in the past or currently, you do all you can to get the word out to the people that are benefited or impacted by the program. I mean, a great one is unclaimed property that I believe Treasurer Diossa also has. This is literally a program where it's other people's money, and we get millions more coming in every year than we can put back out into Vermonters' pockets. We even send, we have an automatic program where we send checks automatically to Vermonters. And even then, maybe 70 or 75% of them get cashed. We had a hazard grant program that we operated in the pandemic that provided $2,000 to individuals that had worked during the pandemic during those early months. And for those that had left their employment, they had to apply to receive the $2,000. And we called people, we texted people, we emailed people, and still we only got a 64% take-up rate. So it's, I think when you're thinking about administering and operating a program, it's got to be one of your thoughts about, will the program, even in a well-intentioned and designed program that will have an impact in theory, how do you make sure the impact is actually felt in practice? And this is a great program in that regard. So I wonder if Eva and Treasurer Diossa can talk a little bit about that.
Sure, I'll just sort of start with the mechanics and then hand it over to Treasurer Diossa. But I would say, there's no application. People cannot apply for this program, right? So the program works by, and the nature of it, which is what makes the return on investment so great, is because it's purchased in bundles, right? So the debts, people don't have to make application. We run the qualification to see if folks qualify for the program, and then we push the letters. The success of that really is about getting the word out, which is why webinars like this are really important. It's why press engagement is important, because you want to increase the visibility and conversation so people know to look for those letters. So that's just sort of a big part of making sure that people are feeling the impact. The second thing I would say is that, the good thing is the debt is abolished, whether people know or not. And maybe they'll find that out if they go and look at their credit report, or they, get a different type of notification. But it's not something that people have to say, oh, yes, please do this for me when I get the letter. So there's no action required on the part of the resident, which is what makes this really exciting, because we are just out there to abolish debt as much as we possibly can across the country.
Yeah, again, I defer to Eva's experience on this, but I think that the nature of our office is that there's a turnover in staff every 4 to 8 years, and so having someone like Undo that has a track record, who's consistent, who has the apparatus to manage all of these transactions, I think it's a good thing for the long-term success, and should give a lot of confidence to the people in Vermont that their information's secure, safe. Again, the whole idea of not having to apply, in some ways it's good, because it won't create any backlogs. If you qualify and your debt is waived, you automatically get a letter. I think it's a very streamlined and efficient way to get folks the results that they want from government. And so I'm excited, because I know that Undo will be sending out 3,000 letters soon to Rhode Island that have been impacted by this program. And I'm sure that we'll get some feedback from folks who will wake up one morning with that incredible debt that's been weighing down on them removed, and be able to start a fresh new day and look forward to purchasing a home, making investments. And if they were concerned about visiting a doctor because of medical debt, now they can go and get that important medical screening for their health long term.
Yeah, that's absolutely right, James. I wonder, we did have a question that came in from the audience, and maybe it's a question for Senator Lyons, but it's sort of a question about, the challenges we face in healthcare in Vermont nationally. But on the flip side, are there things that you feel positive about in the healthcare space in Vermont that you feel we're making progress on? Is there a positive picture to be painted as it relates to healthcare in Vermont and across the country? And maybe Eva, you can speak to this after the senator.
This is a great question. My committee has devoted itself to looking at solutions in Vermont to the terrible crisis that we faced, and cost challenges, the challenges that hospitals are facing in financial stability, the challenges that we've been talking about here with out-of-pocket expenses, co-pays, deductibles overall, and how really challenging it is for the ordinary citizen or the small business or any business to provide healthcare insurance. And then we've seen that recently our largest insurance company being challenged with a low reserve. So to that end, I would say, yes, we have many things to be thankful for in this state. I will put on the front burner the bill that we're working on in our committee, not just medical debt, but a larger bill on healthcare reform. Doesn't have a name yet. It is a committee bill. It is on our webpage. And it does include some movement toward reference-based pricing, global budgeting for hospitals, trying to cost containment, where we know, as you mentioned earlier, we have some of the highest costs in our state, highest costs across the country. And some folks say, well, if it's the highest in the United States, then it's the highest around the globe. But we didn't measure it, so we can't say that. But there is a huge expense that we face in this state. The bills that we've passed recently, Act 167, where we're having hospitals are working collaboratively with the Agency of Human Services and the Green Mountain Care Board to transform their services, to make services more affordable and accessible, to link services with our community supports, whether it's mental health counseling or other. All of those things are going on now, and they are very positive, and they will improve access, cost, and quality. There's no question about it. And I urge folks, I'm not going to go through the entire bill that we are going to be presenting, hopefully to the full Senate in a couple of weeks. I won't go through that entire bill, but it does have some significant reform efforts that should help everyone in the state, I would think, whether it's the insurance companies, the hospitals, the patients, and small businesses who are supporting folks with their insurance programs. So the other thing I think we need to be very thankful for in this state is the strong emphasis on prevention and going upstream with a blueprint for health, with all of the prevention services that we're offering kids, with the prevention services that we're offering adults, and our attention to where the needs are greatest. So we are in a very we're in a good place in our state in terms of thinking about what's important for folks, and that is prevention, cost containment, not reducing services for the sake of reducing services for the sake of cost, but rather ensuring that when services are changed, that it's for a purpose and that we can continue to provide what Vermonters need. I will stop there, but we are doing a great deal, and I'm appreciative of the question, actually. It's difficult to explain complexity. And in our committee, we have a little sign on our bulletin board that says it's more complicated than that. But just to simplify, we are working hard in building on the good things that have happened in the past. And I think the medical debt bill is just one more good thing that we have in front of us.
Nice. Well, thank you, Senator. I wonder if Eva and Sammy have anything they want to add from a national perspective, anything in healthcare that is giving you reason for optimism or something you're excited about.
That's a challenging question, but I think that given the current landscape around cuts to coverage, but I do think that Vermont is a leader. And I think that when we think about what we can do today, tomorrow, something like removing medical debt from credit reports is a really important and wise next step. There's a lot of uncertainty at the federal level. It's very unclear what actually will transpire over the next couple of months, both with respect to the final rule related to removing medical debt from credit reports and the CFPB, but also what's going to happen in the coverage landscape. And I am also a member of New England, and so I also am very familiar with how federal funds are an important and creative tool for us, and how we create solutions and expand our coverage and access to our residents. So It's something certainly we'll all be monitoring, but I also think it's a really important moment as we think about this uncertainty at the federal level to anchor ourselves in what can be done at the state level to create some certainty. And so I think that speaks to where we need to make sure we're building and bringing all of the stakeholders to the table to make sure that we're holding the patient harmless and at the center as we navigate these difficult decisions that might come our way. So, but I think it's exciting and refreshing to hear the optimism and confidence at the state level that there is a commitment to do that.
Yeah, I would echo what Eva has said. I think that there is reason to still have hope, especially hearing all the great work that's going on, as you said here. But also one thing, especially as Eva mentioned and alluded to, some of the cuts to coverage that we're possibly going to see at the federal level is very disheartening. But one thing that's been giving me a little bit of hope is the amount of good information that's being shared among consumers and advocates, specifically all the work that's being done to make sure people are aware of what's happening, know how to raise their voice as a citizen about how they feel about those changes. And also, selfishly, our work gives me a little bit of hope. So our next step in our medical debt project right now is we are currently working on a statewide project on hospitals and what their policies are regarding medical debt. So we're working with the Lown Institute and surveying every hospital in the state of Missouri, similarly to if you saw the KFF Health News study a couple of years ago, looking at how hospitals treat medical debt. We're trying to really just paint a complete picture of what the policies are so that consumers and advocates, legislators, everybody's just aware of what is happening in different places. I think especially somewhere like Missouri, where if there are coverage cuts, those, we rely heavily on certain federal funding mechanisms for our Medicaid program. If Medicaid is cut, that's going to have impacts on coverage. That's obviously going to ripple down to medical debt and what that looks like for consumers. So just trying to paint a clear picture and really let people know what's going on so they know where to go for help if they do run into medical debt and what policies are. Because I think that that's something that, a lot of us have tried to highlight, no finger pointing, just saying this is what's happening. And if you're at this hospital getting this procedure, these are the financial aid policies. And on that note, I'll also say some of the work that some great organizations are doing in addition to yourselves. Thank you again so much. I think this work is great. $4, if anyone is aware of them. So they help out specifically when people are faced with large medical bills. They post a lot on their social media and get the word out about their services. They can help folks who are faced with medical debt sometimes as well. And really help with those large medical bills when people don't know what to do. So they work as negotiators, and I think that work is ongoing all the time and getting bigger. So I'm hopeful to see that continue as well.
Great. Well, thank you, Sammy. We had one last question from the audience before transitioning to sort of closing thoughts and next steps. And maybe it's a question for Eva, but anyone else that has a thought on it. There's sort of a question about, there was a sort of a clarifying question about whether this program was a one-time investment, a one-time elimination, or whether it was an ongoing elimination. And there's certainly things to consider and think about if you're talking about ongoing elimination of medical debt. And I think somebody in a separate question sort of pointed out the issue of maybe moral hazard, or would it add to medical debt if you had an ongoing program? So Eva, you've worked, I know now at this point, with 20 different jurisdictions, 20 different government entities. Has this debate come up in other states? And, in Vermont, just to be clear, we're talking about a one-time investment of eliminating past medical debt. But, what are the considerations around it being a one-time program versus something that might be ongoing?
Sure, this comes up without a doubt. And I think it also depends on the intention and the circumstance of the jurisdiction, of the state, of the partner. So just by way of example, we are working in North Carolina as a part of a project there where we actually are we are completing contracts with 99 hospitals in all 35 systems in the state, because as a part of an agreement in North Carolina, they chose to actually get rid of all the medical debt that was accrued before they expanded Medicaid. So since they just have expanded Medicaid, they have now come to an agreement with the hospital system as a part of their enhanced payment for Medicaid program. Since they expanded Medicaid, they decided to do all the cleanup. right? So get rid of all that debt that people had taken on because they didn't have access to Medicaid expansion. So that's one example of sort of a one-time sort of cleanup approach. Often when we work with a donor or we work with a very large system, it might be that we work with a hospital system that says, well, we'll do it this one time, but then they might come back a year later and they said, actually, can we do it once more? And you can actually share the data with us so we can understand who's in that file. So something we didn't really touch on or talk about is that when we partner with hospitals, we actually are also a resource for them to help them understand who actually is in their bad debt file. And I think that really speaks to giving them information to understand where their financial assistance policy might not be meeting the needs of their patients. So that can they can come back and do a sort of a check to say, oh, did we make a change to our financial assistance policy? Are we seeing that now actually in our data a couple of years later? But because we've only done this for about 10 years, we're still sort of nurturing and, figuring out that pipeline. But I think it just depends on the intention of of either the donor, the hospital, or the location. I will say that to date, we do hear the issue of creating moral hazard, that could be a problem, but yet we have yet to sort of see that show up with patients or hear that from hospital partners.
Just before going to closing comments, anything, James, was that a concern in Rhode Island? Was that part of the discussion?
It was definitely raised, but we knew where we wanted to get to, so we were very supportive.
Oh, great. Well, I think I wanted to give everyone an opportunity to have some closing thoughts, and also in your closing thoughts, maybe less so for Sammy, but maybe for the senator and for Eva and the treasurer. In your closing thoughts, if there are sort of thoughts that you have about next steps in terms of what folks listening on this call, what Vermonters, what their friends and family can do to help this legislation in Vermont, what you have seen in other states, Eva, what you have seen in Rhode Island, James, what you've seen with other pieces of legislation, Senator Lyons, that's effective. We have a big step forward here. We've passed out of the Senate committee on healthcare. We have strong support in the Senate and the House, but still a lot of legislative steps left to go. So I think it's important for us to continue to think about advocacy. So with that, maybe I'll turn to Sammy first for any closing remarks.
Yeah, I think that everything highlighted on this issue today is really important. I want to thank everybody here, all the participants and panelists, and you all for organizing this, and for your great work, everybody. It's just really, as Eva said, nice to hear on the state level some very positive things that are happening and folks working forward on this issue. More than anything, I'm going to keep underlining that healthcare affordability and transparency is the best way to kind of attack medical debt at its core. The work Eva is doing is so great and important, but I know, we've had this conversation, Eva, that we hope that someday we're in a world where that work is not needed because everyone has the access they need, and really getting everyone coverage is the best way to get everyone accessible improved quality care for everybody. So I just want to say thank you. And I think there is a lot of great reason to hope and work being done on this issue. And as far as state steps, I know this question is less so for me, but one thing that, I'll mention that we've seen done in some other states that have tried to take similar measures is that coalition building is just so important. It's something that we're looking at in the state of Missouri as well. So I think that's very wise for you all to be looking at advocacy as a next step.
Awesome. Thank you, Sammy. And thank you again for being here with us. How about Eva?
Making sure I can reach my mute. So first, I just want to say that it's just such a privilege to be here, especially with my friends from Rhode Island, but also to making new friends in Vermont. This is a really exciting time to think about addressing medical debt because it gives people relief. I think people are feeling a lot of anxiety and stress right now. So I think it's a unique opportunity at a very ripe time. In terms of next steps, I think for those that are listening, I would invite you to come to our website, undomedicaldebt.org, look at the stories, do your research, read up on the model, feel like you understand it. and talk to your friends and neighbors about it. I think that, what makes this successful is that when people know about it, they know to open their letters. And then also just to be curious about, what are your challenges around medical debt in your own lives and that with your friends and neighbors, so that you're sharing those stories with important leaders at the state level as they think about upstream solutions.
Awesome. Thank you, Eva. Thank you again for being here. And thank you for all the support Undue Medical Debt's provided us in our due diligence process. I should mention, we started thinking about this bill in Vermont probably 18 months ago, and we've been very diligent first internally, and then we reached out to Undue Medical Debt to understand it more, and reached out to other colleagues across the country to understand it better. And just, you have been a great partner with us every step of that due diligence process. So appreciate that.
Mhm.
How about Treasurer Diossa?
Yes, thank you. No, it's a real honor to join you all and share our experience here in Rhode Island on our success. I know that, for Rhode Island and Vermont, this is a long road ahead. I look forward to continuing supporting your efforts, Treasurer, on any information we could share as a state and where we are today with your constituents. I think Eva hit the nail on the head that the more information, the more public support you have, I think this just becomes more relevant to the everyday person who understands this makes a big difference. Rhode Island is continuing trying to tackle this issue of medical debt. There's legislation being moved in the chambers around capping interest rate for medical debt. And so we've been very supportive of that. We've submitted testimony on that, and we would love to share that with you. But let's get this bill over the finish line, and we'll pass that over to you guys. All right. But thank you. Good to see you all.
Well, thank you, Treasurer. And again, thank you for being here today. Thank you for your support coming up and being with us at the press conference, and for helping answer a lot of the questions we had, and understanding how this would be implemented. So it's always important to have a model from another state, and you're a great model in that regard. So thank you. And now maybe we'll hear from our senator to close us out. And again, just want to extend my appreciation and thanks for your support and good work on this issue and on healthcare broadly.
Thank you, Treasurer Pieciak. It's a real pleasure to work with you. And you have done significant work. We wouldn't be able to have passed the bill out or had as many sponsors without the strong data that you presented to us and shared with us, and all the work that you've done. Now, as we all know, everything is linked to everything else. And what we just heard from Treasurer Diossa is that, there's another step to be taken, lowering interest rates on debt. And we heard, when we took testimony, I heard from our healthcare advocate that there were other things that we could be doing. It's difficult, when you're in the position that I'm in, not to put everything in and to put more and more amendments onto a bill. We've tried to keep that from happening. We do know there is more that can be done. I think the goal that we all should have, and I hope the folks who are on this this call will reach out and support the bill, and understand the bill, and understand the need that we have in this state, where we have $100 million worth of medical debt that can be reduced with $1 million. That's outstanding. The answer that I asked a question about, in my own head, how can a large corporation like Undue Medical Debt want to do this? What's the game here? The answer is there is no game. The people who started Undue Medical Debt, the collectors, understand what patients are going through, understand the need for this bill. So I sincerely ask folks to work on the bill, to contact House members, contact Senate members as the bill goes up onto the floor for a final vote, to ensure that the bill will go forward. I'm not, I do understand that there may be changes in the House. That's very typical. And I think Representative Black will be making improvements as it goes forward. it is important that we not make it a Christmas tree, and that we keep the bill as simplified as possible so that we can complete the work that we've been talking about here today. So just thank you again to everyone for all the work you've done to help with understanding this problem and understanding the bill. And thank you again, Treasurer Pieciak.
Well, thank you, Senator. And again, thank you to our panelists. I want to give them a virtual round of applause. And to that point about coalition building, again, want to thank the Vermont Businesses for Social Responsibility and the Vermont Public Interest Research Group, VPIRG, for being two important members of our coalition as we move forward. And again, thank you all for tuning in this afternoon. It means a lot to have Vermonters participate, and do hope you will take up the advice of reaching out to your representatives, your senators, and being engaged in the process as we hope to get this bill passed in the next couple of months. So thank you, everybody, and hope you have a great day.